We know that the coronavirus pandemic has been first and foremost a health issue. So, what should the world and the nation states do to rethink health strategies and prepare for a similar challenge in the future? We are going to try to address all these questions right now in a very special panel, reuniting authorities of the health field. Não sei se o professor João Bosco Monte tinha algum comentário aqui que ele gostaria de fazer ainda relacionado a essa questão da saúde, como nós ouvimos na mensagem da ministra da África do Sul, tecnologia, a melhoria do setor técnico da cooperação para promover parcerias no âmbito de novas descobertas e de promoção da área da saúde é fundamental. E essas parcerias precisam acontecer, precisam ser fomentadas, mesmo no contexto de pandemia que nós temos hoje. Estamos reunindo diversas pessoas em salas virtuais, acompanhando o Fórum Brasil África, começamos um pouquinho de problema aqui nas nossas conexões, mas é isso, como nós mencionamos, esse é o novo normal. Nós dependemos cada vez mais da tecnologia, nós dependemos das conexões com internet, e pessoalmente preciso dizer que por viver fora do Brasil, que é o meu país natal, também me sinto muito próxima dessa novidade, desse momento tão intenso que nós estamos vivendo. As I was saying, we are addressing right now some questions related with health, and we are going to try to think on strategies to surface this crisis. So to moderate our first panel, I'd like to invite the Head of Public Affairs and Communications at the Mastercard Foundation, which is Julie Gichuru. Hi, Julie. Good morning.
Good morning and good afternoon from East Africa.
Yes.
Thank you.
Thank you very much for joining us today. I'm very happy that we will be able to follow this panel with such special speakers. So I'm sure that the speakers are all ready to join us right now. So Julie, please.
We are all set.
Thank you very much. So please go ahead. The stage is yours. I'm going to come back by the end just for the final remarks. Thank you very much.
Thank you very much. Welcome, everybody, to our panel session, this plenary on global health, upscaling investments to achieve better results. We have an incredible group of panelists with us. Donald Kaberuka, who is chairman of the Global Fund, AU Special Envoy for Africa, and founder and managing director of SouthBridge Group. Bineta Diop, the AU Special Envoy on Women, Peace and Security. Nísia Trindade Lima, who is the president of FIOCRUZ. We have with us Otaviano Canuto, former vice president and executive director at the World Bank, and Dr. Carlos Malet, who is co-founder of Sphera Global Health Care. And they're coming to us from right across the globe to share their perspectives on this absolutely key issue. To all the panelists, I really want us to dive into very practical conversations. We did hear in the opening just now that humanity is facing an unprecedented crisis. It's a health crisis, it's a social crisis, and it's an economic crisis. And the big question is, how do we ensure that we can achieve results in healthcare? We've talked about UHC for decades and decades. We thought we had been making some gains. Now it seems coronavirus, the pandemic, has shown us just how much there is that needs still to be done. Dr. Donald Kaberuka, let me begin with you, please. From your perspective, what we are seeing on the continent, you are in Kigali right now. We know Rwanda has really managed to, brave this crisis and fare much better than other countries. What are you learning there, and how can we do better on investments in healthcare and healthcare systems? Donald, over to you.
Julie, can you hear me now?
Yes, we can. Please go ahead. Thank you.
Thank you, Julie. Thank you, colleagues. It's a pleasure to see you all. I think There are three major lessons from this crisis. The first one is that in the last decade, the world has seen two major shocks, which have been handled so differently. In 2009, there was this major shock in the global financial and economic system, handled very competently by the G20. We still have aftershocks of that crisis, but the way the world handled the global financial crisis was first in class. 10 years later, we have another major shock, handled very differently. I would say it did not matter how rich or poor countries were. What mattered was the competence of the state in responding to this crisis. And that is not surprising because unlike in 2009, this time round, the G20 has not stepped up to the table with the vigor and ambition which we saw 10 years ago. The response has been very much global north, nationalistic, protectionist, and therefore the dynamic needed to work together has fallen behind. These are two important lessons. The related lessons, then to your question, Julie, is about the fact now that we can all see the clear link between health and the economy should now be a spur, a window of opportunity for all of us now to increase our investment in the health sector. Not simply more money, but better spent, value for money, because this will not be the last pandemic. At the beginning of this crisis, there was a general view that Africa would be the country most to suffer. What has happened on this continent is that precisely because we knew our systems were weak, public authorities took measures which were needed. In other words, stop international travel, stop intercity travel, these massive lockdowns. So the short-term cost for the economy has been quite big, but lives have been saved. Now, if you look at the numbers for this year, Africa's economy will be smaller by about $200 billion. Next year, the same. And therefore, recovery will be very complicated, especially with limited international cooperation. But I think it will still be possible. So I should end by saying here, Julie, that the last 30 years in Africa have been exceptional. Economy is growing for the first time in real per capita terms for the first time, i.e. economy is expanding above population increase. For the first time, Africa was the second fastest growing continent. For the first time, the deaths of children, HIV/AIDS, disease burden, had already declined at the fastest rate in history. What COVID has done is to set us back 30 years and also to undermine our future ambitions. So for me, it is not simply a pandemic issue. It is an issue where we have seen now the close link between the economy and the health investments, and also what weaknesses in multilateral cooperation mean when we have got a major pandemic like this one. Thank you.
Thank you so much for that. And just drawing on that close link between the economy and healthcare. Otaviano, let me pull you in here. You've heard Donald's remarks and really would like to get your perspective. How can we do better, and what must we shift?
Thank you, Julie, and thank you all for having me here. I like very much the way Mr. Kaberuka framed the issues ahead. And let's say that I can speak from a Latin American and Caribbean perspective, as I'm a Brazilian. And truth is that the region has been the hardest hit in terms of so far, in terms not only of case of health impact, but also economically. If one looks at the IMF forecasts released a couple of weeks ago, the average growth of emerging markets in developing countries is not a good benchmark for the region, because the impact of coronavirus in the region has been even, let's say, deeper than in other parts of the world. And that has to do with unique features of the region, the degree of agglomeration, but also necessarily the lack of appropriate response in terms of health policies. Take the case of Mexico, where literally the hands-off approach taken by the president and the health system has led to higher rates of contamination. Take the case of Brazil, in which you had a mismatch between, on the one side, the attempts to respond with measures like Mr. Kaberuka described for Africa and so on at the subnational level, but not coordinated, not with some kind of support from the federal government, and so there are clear failures. In some other cases of other countries, some stiff containment policies were implemented, but given the levels of agglomeration of people in slums, in cities, and so on, we have seen a daunting performance when it comes to contamination. One point that I want to make is the paradox that, on the other hand, more than ever, one can establish today a blueprint, a benchmark of what needs to be done, what are the components of a health policy response to issues like coronavirus, which we understand may repeat. No one can take for granted that this is a single case. And as Mr. Kaberuka appropriately remarked, more than ever, we need cooperation. We need some sort of exchange of experience, and because the use of digital technologies will be a core component of any health policy response in the future. And paradoxically, when more we need mutual cooperation, the less we have of it. We have this retrenchment of countries in the response of countries, the advanced economies, the G20 countries, has not been as cooperative as it was the case of the global financial crisis. Thank you.
Thank you. Thank you for that. You know, we're seeing common threads, compliance of the state, Donald referred to. You've talked of lack of appropriate response. We all understand the importance of leadership driving the direction for purposeful transformation and for us to be resilient. Bineta, let me come to you next. Tell us from your perspective, what are the things we need to do more of to get through this and to build resilience in our health systems? And how do we draw the investment in?
Thank you so much, Julie. And let me just agree on what have been said before by Donald and Otaviano. But I think it's important that when we are building back better and we are designing new model of financing, we know the costs on our population, on our community, the costs that we are living. And we look at the data that have been given when it comes to the impact on our communities, the impact on women and our children right now. And when you look at what the World Bank have said, the estimation that a 23 billion deficit that will happen if we continue in this path on maternal, newborn, child, and adolescent health. That's the reality that have been said. When we look at also what the UN, the UNFPA have said, that if we continue to have the lockdown in 7 million intended pregnancy, that's what the UNFPA have said in the 6 months again to come. 31 million additional case on gender-based violence. I'm just giving this female genital mutilation, the child marriage. And every time they said, if we continue, this is what we are going to face. So there is the health workers themselves, the health workers that are facing infected, but already impacted, the emotional and physical conditions. So the new model should take into consideration those aspects if we wanted to build back better. And Julie, I think that we need to look at, for cost effectiveness, to look into the empowerment of the communities, in the health workers communities. I think any financing should take into consideration. When you look at what Liberia at the end have done to fight Ebola, you know, they involve in a more cost-effective way the communities and empower them, give them, not see them just as a tool, but make sure that we give them long-term capacity. You know, there are solutions that we can scale up. My country, for example, Senegal, we have something that we call the Bajanugo. It is really empowering the community to respond, to be within the system and can respond immediately. So maybe in our discussion, we should see how do we build the capacity, the resilience of the community, and putting the women and at the forefront in the response. I will come back to the issues of public-private partnership, how we can build on that, not just leaving it to the public, but making sure that we also bring, especially the local private partners that are underground. Thank you.
Thank you. Thank you so much for that, Bineta. Let's empower our communities to respond. Let me come to you, Nísia, next. And from your lens, what are you seeing? And what are the shifts that we need to go through to really make a change in the way that we run our healthcare systems and draw investment in?
Thank you. Good morning, good afternoon for everybody. Well, I think that I am very worried because we were discussing the Agenda 2030, the advances in the process, and now, not only because of the pandemic, a lot of factors, but we see regress, setback in many policies. So I think that I am very worried about this. In my perspective, as the leader of FIOCRUZ, we have to think about the role of science and technology to promote the SDGs, to promote cooperation, and to think health and science and technology as part of solution for crisis. At FIOCRUZ, we are organizing many actions, since research, from research to produce vaccine in this context. And so I think that health should be seen as part of solution. We work with the concept of health economic complex. And by this way, I think that we can deal with these dimensions, economic, social, in this perspective. I think that Brazil can have a role in this context and promote cooperation with the countries of Latin American, African countries, BRICS, as in this morning, in this perspective. I think that is a very important point. At the same time, I think that we need research from biomedical research to social science research, because the social impact is very deep. And I think that we have to deal with this impact for more than a decade, I suppose. So I propose a program. And I think that's very important to have an international program deal with all these dimensions. In terms of the Bineta speech, I think that all the role of the ONU Population Fund, como se chama mesmo? UNFPA, the goal of the reduction of maternal mortality and the freedom for women is very, very prejudiced by this context. So I think that just to put the SDGs and the Agenda 2030 in perspective and in good conditions now, we have to promote a very strong international cooperation among institutions, among international agencies and countries now. Thank you.
Thank you so much for that, Nísia. And just to restate the urgency with our women and girls, I was speaking to an incredible young champion in the Samburu community who saves girls from early marriage and early pregnancies. And a lot of those girls, 400 who had been under her care, many of them now with schools closed, back in their communities, have been married off once again. Pregnancies, once again, we're seeing them rising. We'll come back to this issue because I think it warrants a lens. Before we close, we will come back to this and focus a little bit more. Carlos, let me come to you next, and maybe let's zoom in a little bit on the question of investment and the work that needs to go into attracting the right investment that's patient enough to allow the systems transformation, to do the hard work, to really effect change, and particularly the investment coming into Africa. Talk us through your thoughts on this.
So thank you, Julie. And to build on top of what was said before, I think when we look at investment, we look at one hand the public system or public health and the private system. And in regards of public health, I think that as Bineta pointed out, the importance to reinforce, to strengthen the network of health workers is crucial. It's crucial for the development of any public healthcare system. This being a Brazil-Africa forum, I think is actually a great platform to be able to exchange knowledge and experience. We have an example, this being the Rwanda healthcare system, that has been a system studied and known worldwide for being extremely effective on how they've created a network of health workers that are doing great job for the community to be able to understand the current situation of both in the rural or main cities. And so I think that there's a lot of room for sure for improvement, but a lot of exchange that can happen in this forum and between the countries that are involved into this platform with the support of large organizations like the World Bank or WHO or other foundations. When looking at the private sector, which is probably the sector that we've had more experience in, despite the fact that we are involved also in PPPs, what are the key ingredients that we're seeing essential to attract investment? So nowadays, the situation in, I would say, most Africa countries, and especially when looking East Africa, West Africa, is the fact that there is a growing community that is willing to be able to access private health services. There is a growing community, the population, as Dr. Kaberuka was pointing out, the economy is developing, the population is growing, the financial capacity is growing. Therefore, there is a demand for private services, and also on the healthcare side. What has been the limitation that we've seen on the healthcare side? The limitation have come from being able to access specialized care. So we have a growing community of doctors, of nurses, that for them to continue to learn and grow, they end up going abroad. We've been experiencing now for a long time, for example, Angolan doctors and nurses going to Brazil for training. The difficulty comes when those doctors and nurses have to move back to their country of origin, go back to Angola, go back to Nigeria, go back to... The main limitation is the fact that they cannot continue to grow as a doctor or a nurse. Why? Because at the end, their colleagues, their environment is not going to help them grow as fast as they were doing maybe in some of the top hospitals in Sao Paulo, like Osvaldo Cruz. These hospitals are today leaders worldwide, and the possibility to be able to access one of those networks for a doctor or a nurse is is really, really valuable, which is a difficulty that they may have when they have to move back home. So what is needed from an investment point of view? What's needed from an investment point of view is to have those large hospital groups, those large healthcare groups, private healthcare groups in Brazil, in Europe, in Northern Africa or Southern Africa. Those large groups invest into private health infrastructure and invest by sharing knowledge. Sharing knowledge from what point of view? From the point of view of bringing expertise, doctors and nurses actually delivering service locally. How can this be achieved? Can be achieved by creating programs where some of these doctors are on rotation. Doctors that are basically from Rwanda. We've seen a lot of doctors go to Belgium. We've seen a lot of doctors go for training in the United States. How can we get the involvement of many of these doctors, not only Africans, by having a rotation? We see a large number of doctors coming from different parts of the world to Kigali, to Abidjan, to deliver surgery for 2 weeks, 3 weeks, a month, but then they go for a week, 2 weeks, and they leave. So what does the private sector need to achieve? So these large groups that have a large number of doctors and nurses have constant involvement of those doctors being present. Thanks to the pandemic, what are we experiencing in the private sector as well as the public sector? Telehealth is already a system that is in place. We're able to connect patients and doctors remotely, even if they are in the same country or they are not. So that possibility of involving highly specialized care on the day-to-day care of the local population is what's going to transform significantly and what's going to help invest on the private sector. But therefore, I think that the main effort has to come from the healthcare groups, private healthcare groups that invest into expanding their reach into countries in West Africa, in East Africa. And we have groups like this in Brazil. We have groups like this in Europe that have been right now looking at the situation, but maybe from the fence. And they have support because they have groups like the World Bank, like several DFIs, that if you come as a promoter to invest in the healthcare sector, they will come and they will support that investment. But I think that it's not only investment from a financial point of view that is needed, it's actually investment by bringing expertise. And that expertise, all those large groups of hospital chains, of clinic chains, of different specialties, are the ones that need to take the step, and they need to therefore, have the access to the countries. And that's why conferences like this ones are so important, to put these kind of groups in contact.
Thank you. Thank you so much for that. And that brings me back to Donald. Donald, let me come to you with this. And clearly the Africa CDC right now is playing an incredible role on the African continent. Maybe, I never before have I seen this level of collaboration happening between states and non-state actors as well, coming together to address this issue. As Mastercard Foundation, we're actually one of the partners supporting Africa CDC in equipping health workers across the continent. Donald, let me ask this question. What more can we do when it comes to global cooperation and solidarity to ensure that Africa is fully able to do the things it needs to do? And I think Carlos has spoken to quite a number of those, as have the earlier speakers. Donald?
Julie, thank you very much. Before I come to that question, Julie, let me say this is Brazil-Africa Forum. And one thing we have learned during this crisis is that in the context of an economy which is dominated by informal sector, when you have weak social protection systems, like they have in Brazil, or they had under President Lula, I don't know if it still exists, the Bolsa Familiar. I think we need to figure out how we can learn from the Brazilian experience to build this system of social protection such that in future, if we have a pandemic of this nature, we can learn from the best practice. I hope the Brazilians still have that and have built on it, because it is something we'd like to learn. Now, 3 more points, Julie. Number one, it looks like COVID will be here with us for quite a long time. We should not discuss as if COVID is a malaria fever which will go away. It looks like COVID is here to stay. Second, although COVID has been a huge crisis for all of us, actually there are many more people today dying in Africa from malaria, tuberculosis, HIV/AIDS, and many other diseases. And therefore, anything like COVID which disrupts the capacity of the health system actually causes more death from those traditional killers. The third point, this is not the last pandemic. So how do all these three come together? They come together in the following way. We have to build resilience, but we cannot build resilience along what high-income countries have done in their health system. You could see even them, the rich countries cannot cope. So we have to figure out how to build our resilient health systems within constrained fiscal space. Look, WHO says per capita spend for health should be $150 above. We in Africa think we're aiming for $83 per capita. But whether it is 83 or 150, there are things we can do. Here in Rwanda, what they have done, building on fairly simple tools of building resiliency, universal health workers, basic insurance, leveraging technology, simple technologies. The country has been able to protect its people much more than richer countries who are spending much more on health. As I mentioned before, how this country has handled COVID. So the issue is, at what level of spend can we actually build greater resilience? Because we'll never have enough money to spend $150 per capita. I hope we get there. But there are lessons within Africa we can exchange among ourselves of how you build a resilient health systems, which is not necessarily a European 1970, 1980 public health system, which even that is not coping. The third point, I go back to the fact that malaria still kills 500,000 African children even today. And therefore, in preparing for this post-COVID situation, the Global Fund, whose board I chair, we took the view that one of the first things we have to do is protect the achievements of the last 30 years in terms of death of children, in terms of HIV/AIDS, in terms of malaria, right? You could not shift all the resources to fight the pandemic, forgetting all these killers who are actually still the major problem for us. So the Global Fund put out there $1 billion to help countries access kits, equipment, but also build the kind of resilience I'm talking about. Now, the last point before I come to you, Julie, is access to vaccines. Since COVID will be with us for quite some time. Now, the issue is who gets vaccine, who gets access to it. At the beginning of this crisis, even African countries with money to buy testing kits had huge problems getting access. We benefit enormously from the Center for Disease Control in Addis Ababa. They were able to build a platform which enabled our countries to get, to some extent, to the kits. I hope when the vaccine becomes available, this is the first test of international cooperation, because you have asked me. Rich countries are now pre-purchasing those vaccines. The COVAX initiative will probably cover 90 countries. Other 90 countries will have to pay for themselves. And that will cover only 20% of the population. So for me, test number one, the acid test of whether international cooperation will meet the needs of the future is what happens access to vaccines now in the next few months. I hope and expect that all these big initiatives being announced mean that African countries, Latin American countries, Asian countries, Caribbean countries will be able to access vaccines like the rich countries at affordable prices. That will be for me the first test. Now, what the African Union has done is to strengthen the Center for Disease Control in Addis Ababa for data, for information, for prevention, first class. And thank you for what Mastercard and others have done to help us on this. And these are things we can do between countries of Asia, of Africa, and Latin America to cooperate so that we build our own preventive capabilities. President of South Africa, who is the chair of the union, has also appointed a number of special envoys, of which I'm one, to try to figure out what international cooperation should look like in this crisis so that together we're able to leverage on each other's strength. This is the time when the idea of a global north handling its own problems and the global south left on its own is completely meaningless. But seems the leadership quantum we need around the world to ensure that, for example, vaccines are available, to ensure that resources are available to build the resilience we need, we require a lot of leadership we need now in the G20, in the G8, and beyond. I think the African Union has shown the way, and I hope with the Brazilian counterparts, we can figure out how to leverage on each other's experience. In case of Africa, resilient systems at very low level of spend. In Rwanda, $60 per person, but we're providing healthcare to a very large number of people who have been able to cope with COVID better than very wealthy countries. And then from the Brazilian friends, as I said, I hope they still have these social safety net systems, which would be very much interested to learn from. Over to you, Judy.
Thank you so much for that. Otaviano, I come to you with that as Brazilian, talk us through these social safety net systems. Are they still in place? And also your thoughts on how we enhance cooperation and solidarity.
Right. Thank you. Well, first, one of the legacies of the COVID crisis definitely will be a broad call for enhancement of social protection systems, whatever be the different shapes that this call will take place everywhere. Take here in the US, I don't think ever politically there has been such a strong call for universality of access to health. This will be influential in the election today, hopefully. But also this is a broader. In the case of Brazil, and I can tell Mr. Kaberuka the following: the conditional cash transfer system developed by in the previous government started with President Fernando Henrique Cardoso, and it was taken fully fledged by President Lula. It has been broadened in the following sense. Look, the informality showed to be clearly a weakness and for our countries. Even in the case of Brazil, where 45% of the occupation of labor was estimated to be informal. Compare this to 90% in many other developing countries. And the fact is that even being 45%, it was a humongous one. And what the coronavirus showed clearly was that the sample, the part of the population covered by the conditional cash transfers was too small. And a huge effort was done to broaden the base in order to implement the emergency aid package, a joint endeavor by the executive side of the government, but with the support by Congress. That broadened it to something, maybe Nísia has the exact figure, but something beyond 65 million Brazilians. And that what made possible the transfer of income, so as to at a substantial level, in order to, let's say, to avoid a disaster deeper than what we saw. Point is, it cannot, financially speaking, survive with the magnitude that it took place, because it was a humongous impact. Just to give you an idea, it is the reason why the Brazilian GDP forecast, which was by April, May, at the range of -9% by IMF, World Bank, and OECD, is probably ending the year with a more humble something between -5 and -4.5%. And the reason for that is that the amount of income transfers through the emergency aid that included not only the previous conditional cash transfer, but beyond a substantial higher number of Brazilians, was even larger than the downfall in the wage bill in the country in the first half of the year. This is what differentiates, for instance, Brazil from Mexico now. Mexico didn't do this, and that's why the GDP in Mexico, like in Peru, is going down the drain in 2 digits. The point is, as I said, we cannot sustain this. The program has been extended for until the end of the year for half of the value. But we know that from next year on, we will not go back to where we were, Brazil. There will have to be a program that encompasses a substantial larger cohort of the population beyond what we thought was covered by the conditional cash transfer. There are a couple of important things in that regard. There is a challenge of the fiscal adjustment in Brazil, but it is possible. And my former colleagues at the World Bank, they produced a report that was released 2 years ago, or a bit more than that, showing that the coexistence of several social programs in Brazil should be subject to evaluation so as to unify them and build a single program with a wider coverage than the existing ones, and more effective, because the fact of the matter is that in Brazil you have several programs, and sometimes some families get 2 or 3 of those, whereas some are still left aside. So I guess in this case, Brazil constitutes an important reference when it comes to the need to do a drive towards registry, a drive towards building a cadastre, a single one, because this may be extremely useful in the future as well for what my colleagues at the World Bank used to call knowing the poor by the name, having the decentralized, the complete data information on issues that go beyond simply income, but also qualification, so as to design better social policy in the future to enhance the fight against poverty. So definitely, Mr. Kaberuka, not necessarily because of the orientation of the president, on the contrary, maybe. Fact of the matter is that the previous experience of Brazil has been broadened to encompass a large portion of the population, and this will not be put back into the drawer. I think this has come to stay. That's one important thing in Brazil as well. It has become clear the need to have the physical integration of slums. The rich people who live in their condominiums have realized inevitably that it matters what happens in the slums, because if there is no sanitation, if there are no appropriate health conditions, there is a negative spillover on them, even if they have their tall walls to protect them. In other regard, the virus does not respect walls. So I think a second component. And on cooperation, I guess nobody better than Nísia to talk. FIOCRUZ is a reason of proud for us Brazilian, and it's an institution with a long history, and we have others in Brazil, and where for the federal government to use them better, definitely we would be in a better shape. But they're doing their work. They're getting a vaccine.
Nísia, let me come straight to you with that. Let's talk cooperation and solidarity.
Oh, thank you. Thank you, Canuto, for so gentle words. But it's FIOCRUZ this year completed 120 years. And we are Thank you. We are facing many sides of this pandemic, and we organize research in terms of public view about FIOCRUZ, and is one of the most important institutions in Brazil in the public perception. I think that's a very good point. Well, first, the number of people in the emergency support program now, 6-7 million people, 6-7. And I agree with you, Canuto, about the need of increase the social protection in Brazil, in Latin American and African countries. I think that's a very, very important point, because we are facing with a very deep crisis, and we have a social methodology in terms of social policies very, very well conceived, and we can improve this. In terms of cooperation, I think that we have to enlarge the horizontal cooperation. We can reinforce the idea of universal access in terms of vaccines and diagnosis, also diagnosis for COVID. And in time of pandemic, you have to think about interdependence. Not only in the national perspective, but interdependence. I think that is a very important point, maybe to reinforce the role of international and multilateral agency in this context. Besides this, I'd like to mention a point about vulnerable people. At FIOCRUZ, we face the pandemic 6x. 1x research, and especially the research about the virus. We are coordinating a national network about the mutations, possible mutations of coronavirus. And at the same time, we are participating in training of human resource in the health workers. I think that is very important, the point exposed by Malet about the health workers. I think that in health sector, we can enlarge the action of health workers and the family health program. At the same time, is a health contribution and a social contribution. We are dealing with the vulnerable population, but with some initiatives sponsored by public resources and by public funds, and at the same time by private sector. And we are organizing a plan with leaders by slums in Brazil, just to reinforce resilience and autonomous response during the crisis. Not a vertical perspective, but an inclusive in terms of social perspective and also political perspective, organized with the leaders of these communities. And we are facing very good initiatives in some slums in Brazil, with using tests, diagnosis for COVID, using community capacities, working with women at the communities. So I think that it's a local, and we need to have a scale, of course. But I think that we can look at this good experience besides promote general social policies in the country. And the last point, I think that the international cooperation is very important for us. We are producing not yet, but we will produce a vaccine for COVID. The production is supported by the agreement of AstraZeneca Pharmaceutical. But the point is we will have the complete national capacity to produce the vaccine. Of course, we are waiting for the last results of the clinical trials. And I think that the international cooperation in the second stage will be very important. We are, as a country, integrating the COVAX initiative. So I would like to reinforce Donald's point about the importance of the access for our countries, all the countries. I think that's the last point I would like to reinforce. And just one point more, the idea of the integration between primary care and the specialized care and the surveillance system. I think that the health workers in the primary care programs can help the surveillance in the future for this pandemic and for next, unfortunately, health emergencies that the world have to face next years. I think that's a very important experience. I think that we can improve this in Brazil. We have the experience, but I need to now integrate more and share this experience. It's not high technology. We are speaking about the organization of the system as an innovation. So I think that we can share this kind of experience to benefit our country, Brazilian and African people. Thank you.
Thank you so much for that, Nísia. Bineta, I come to you next. And, we're walking a difficult line here. There's a lot to be done for our communities. Across the continent, much of this has been seen as development work and perhaps not, not a sector that, private sector would want to invest in. And yet, there's huge knowledge, research and development, the training aspects, the jobs. At Mastercard Foundation, we're really focused on jobs for young Africans, dignified work. And there's a whole load of jobs in healthcare on the continent, How do we then attract, do we need to shift anything in our approach to really draw in the investment, but also ensure that it is not exploitative of our community? So how do we achieve that balance, do you think?
Thank you, Julie. But let me go back to what I have heard before, which is, I think, how we can build that South-South cooperation. And I think that Brazil have, demonstrated a lot of experience at community level, and it's something that we need to know better through this platform, probably with the SouthBridge. But also, let me go back to the issue that you have said that the African Union and Donald have, alluded to what the CDC have done as a model of private and public sector together, putting in place the response in terms of the financing, in terms of distribution of PPE, and using the digital. I think this is also something that Africa can show, because people say what CDC have done and how we can, put that by putting special envoy, by mobilizing resources, by having the leadership of South Africa, and so on and so forth. All the things that have been done to minimize the risk within the Africa at the Africa level, and we need to share that experience as well. I like also what Carlos have said. The model of Carlos in terms of investing into the workers that are at that level, that can be trained, that can be deployed. And I think that is where we have the young people as well. You have a huge community of youth, and it will be double in the years to come. And we need to create jobs for them. We need to train them, bring them in that the sector of health sectors, but also by providing them with the skills and the tools, but link them around network. And I think the model that that was shared by Carlos can be also something that we can leapfrog and make sure that it is not stayed at one stage, but we experience it in other places, like in Africa. How do we use the digital? I think it is very important. It was said that it can also serve technology to improve also the diagnostic, the responses on so many. So use the digital to accelerate those solutions. I think is important. Now, when it comes to the financing, the perspective, we know the crowdfunding models that are emerging, but we know that there are some kind of limitation within those models as well, especially, and I think that the Brazil can also tell us how the crowdfunding model have impacted, in a positive, or what are the limitations. I think now we are coming to look into the discourse around the insurance and micro insurance models. How do we make sure that we leverage on what is existing, and how we make sure that we accelerate it on the benefits of the women and our population, the young population. So leveraging on the full capacity of the private sector. We don't leave it only to the public, but the private sector around the value chain of the health system, I think will be one of the good model that we can look and leverage on that. Thank you.
Thank you so much, Bineta. So, Carlos, we're close to closing, and I want you to map for us. It's been a great discussion, really great insights from everybody. What are the next steps? What are the must-do things to ensure we do upscale investments that are going to make a difference for the African continent and achieve the results that we need?
Well, thank you. I think as next steps, everything that has been discussed here is crucial. But again, when maybe looking at the private sector, and as Bineta was referring, the importance also on the private sector investing into development of the healthcare system. I think as next steps, again, I insist, I think that putting in contact our entrepreneurs in Africa with the leading healthcare groups in Brazil that can bring know-how, expertise. I think that in terms of resources, in terms of technology, in terms of equipment, Africa has that. We have great technological hubs. We have young population extremely motivated to learn and to evolve and to work for the healthcare sector. I think it's a matter of, by having different leapfrog effects that can be caused by sharing knowledge. Sharing knowledge is the critical aspect here. And therefore, we really have an opportunity. And this is an experience that Brazil has, because Brazil has had to share the experience in Sao Paulo, which is a healthcare experience, healthcare know-how that not only the rest of Brazil is benefiting from, but Latin America is benefiting from. Sao Paulo is a hub recognized worldwide. And there is other hubs that are also helping and develop their communities, their regions. So I think that we have a unique opportunity now that healthcare is in the center of action, is in everyone's minds. Now that technologies has had a significant, an effect, right, on the way we deliver care. You look at the top universities in the world, the top hospitals in the world, like Johns Hopkins, like Mount Sinai, they are seeing patients remotely. 75, 80, 90% of their patients are being assisted and diagnosed remotely. And maybe the word diagnose is too strong to say in front of doctors, but maybe pre-diagnosed. They're giving an advice. They're giving the right way to access the best doctor, to speak to the right specialist. And I think that, our next steps are definitely on the private sector is continue to receive the support of institutions, again, like SouthBridge, like the World Bank, IFCs, to put in contact private groups in Brazil and not only Latin America, in Europe, with groups in Africa that have grown significantly, that so far have been receiving most of the support from Indian groups. Indian groups have been doing a lot of work already by sharing experience, by bringing experts. But I think it's not a matter of bringing Indian doctors to Africa or bringing European doctors to Africa. It's a matter of generating those rotation systems so that, yes, those specialists come, but our junior doctors learn and learn faster. And it's not our junior doctors having to go all the way to Europe, to the US, to Brazil to get trained, which also they will get the opportunity for sure for specific development, but actually, yeah, getting the resources all the way to the communities really, and to the different countries.
Thank you so much. And as we're just getting towards the close of this great discussion, we're coming down to the importance of knowledge sharing, and a platform like this, the Brazil Africa Forum, which allows us to understand, how do we learn around, how to better implement social protections within Africa, examples from Brazil, but also partner, possibly with the leading healthcare groups in Brazil to ensure that we are building knowledge and capacity on this continent to really address our healthcare issues. I want to ask Caroline from the Brazil Africa Group to maybe share 2 or 3 comments that have come in as we've been engaging in this discussion. Caroline, a few comments?
Thank you, Julie. This is indeed a very strong panel. I was here following all the statements and all the thoughts, the panelists, and also your interventions. Julie, thank you very much. We have received a lot of questions. Of course, we don't have time, unfortunately, to try to address them all. But maybe one question that is really pretty much repeating here is regarding the question about cooperation. How to strengthen cooperation, maybe address it to Dr. Kaberuka. It is a suggestion. How to improve cooperation, thinking on a more intensive cooperation regarding Brazil and the African countries, Dr. Kaberuka.
Thank you very much, Caroline. Thank you, Julie. Thank you, colleagues, for your perspectives, which I found very enriching. I think I did mention the crisis of 2009 and how the G20, which were the richest countries, came together, but without forgetting the Global South to address the global financial crisis. This time round, as I mentioned at the beginning, it seems to me that the global north has gone back to its ways. At the beginning, even countries with money to buy testing kits could not find the testing kits. And I was saying I'm hoping that for vaccines, that is not the case. But since we're living in a weakened multilateral world, we're living in a world that has gone to be from multipolar now to pluripolar, I think it would be important to figure out a way in which to reignite cooperation through the African Union, of course, between Brazil and other Latin American countries with Africa. There's a lot to learn, not simply from managing pandemics. It's about how to managing different things we do. I mean, moving out from pandemics, for example, it is amazing how these social protection programs worked under different leadership in Brazil. Of course, they are not perfect, but so is Mexico. Now, when this pandemic hits, we don't have that knowledge fully embedded in how we develop the safety systems. And I do think, whatever the imperfection of what happened in Brazil and Mexico, I think we need to figure out a way, mechanism to do so. And this, of course, is for the African Union. And as a special envoy of the African Union on this issue, I'll be passing on this information and urging that we reactivate our cooperation with Brazil.
Thank you,
wonderful,
Dr.
wonderful.
Wonderful. Thank you very much. Just to boost for our next intervention, Madam Diop, we have received a question. Enhancements of social protection measures and universality is a key at the moment. So, Madam Diop, your thoughts just for us to end up this amazing panel on social protection measures.
Thank you for that question. I think that as we look at the model of Brazil, and we see the commonality between, I would say that the South-South commonalities, as has been highlighted, I think we need to look at, and I will come to the issues of the health workers, which is dominated by the women. It's the women face and the youth face. And how do we make sure that we put them at the center in the solution that we are going to craft? Some of the solution you have already talked about. When we are deploying the social workers, how do we send them abroad to Brazil, for example, to be trained to come back and to make sure that they are put in a system when they can deliver into their community? For me, it's really putting the people at the center of the transformation, the people at the community, the women and the youth, and investing really in that in that kind of system. So I think that Africa is doing very well. Kaberuka talked about Rwanda, my own country, Senegal. When we look at what at the community, the Bajanugok, which is a network of women that are wise women that are delivering right now the services to their community, is a very good example that we can leverage at the African continent to make sure that the people are there. Is not left only to the public-private, but when we talk about public-private, we also talk about the people themselves, the community, and we give them the tools to be part and parcel of that transformation. Thank you.
Thank you, Madam Diop. I feel that we can spend all day here, but unfortunately we can. So, Julie, your last remarks moderating this amazing session?
No, just really, really inspired by everyone. And I think we take the caution from Donald Kaberuka with us. You know, COVID is here. Coronavirus pandemic is here for a while. So let's work together. Let's cooperate. It's not a respecter of walls or of borders. And we must cooperate to really build resilience in our communities. Thank you all so much. It's been a great panel. Thank you.
Thank you very much, all. Dr. Thank you, Dr. Otaviano, Dr. Carlos Malet, also Dr. Nísia. Thank you very much for joining us today. We had such an amazing panel right now.